Hello and welcome. My name is Mark Blatstein, the physician founder of Physician Presentence Report Service. Today I'm going to review medical and co-payments. And while it's not a very interesting topic, getting charged $2 to see medical can become quite a nuisance. And there are certain things that you need to know. And I'm going to show you the document at the very end or the short list, but essentially it comes under, there's a program statement P6031.02, healthcare visits with a fee of $2, specific inmate co-payment program attachment G. Summarizing it, and then I'm going to go into detail. Sick call after hours request to see a healthcare provider. If you're asking a non-medical staff member to contact medical for a health service not listed in subsection C. So the first problem is you have to find the only person you're going to find after hours is non-medical. So you're going to ask correction staff. So what is the subsection C parts? They are healthcare services based on healthcare staff referrals. Well, you can't find that after hours. Second, healthcare staff approved follow-up treatment for chronic condition. Well, if you need the assistance after hours, this doesn't apply. Preventive care services. Well, this assumes that you don't have a problem now, which you do. Emergency services. So what's the definition of that? There's a plethora of medical conditions, each which could be an emergency, and none of which is addressed here. Prenatal care. Okay, well, that may not apply. Diagnosis or treatment of chronic infectious diseases. Now, this is an interesting area. So we're already dealing with a prison system that is overcrowded, understaffed, which means if you didn't get to a nurse or a doctor during the day, you're not going to get to them after hours. And yet, if you have a problem, one of which may be an infectious disease, you're going to get dinged with a $2 visit. Plus, there may not be anyone there. And part of the reason is that in some prisons, the nurses have had to change job descriptions and become correction staff. Mental health care. Well, if you need a mental health care visit, you may not be in your right mind when you're asking to see medical. Doesn't make sense. Substance abuse treatment. Again, if you're coming in and you have a substance abuse problem and it's not being addressed during the day, chances are you're going to ask to see medical. So all of those 8 instances are fit with problems. And last, if you're found responsible through a disciplinary hearing, meaning that if you injured another person in the prison and they have to seek medical, they're going to charge you for $2 for their visits. So that makes sense. Everything else we've gone through, while it's in print, it's going to be pretty difficult for me to lay out good reasons for you, but I'm going to do my best. And then I'll show you the list at the very end. All of these can be, at least you can do your best to address them long before you get to prison. And by that, I mean by having a comprehensive medical record on yourself before you get to your pre-sentence interview. If you have any sort of medical problem, no matter how slim you think it may be, every detail, no matter how minor, needs to be documented into that record. All of your treatments, no matter how rare that you get them or how minor to you they may seem, need to be documented. All medications need to be documented into your medical record before you get to the pre-sentence interview. All of the medications you're taking. I have another video that I'm going to do again, but that if the medications you're taking are on the Bureau of Prisons formulary, which is their list of drugs, generic, that they give you, but it's on their generic non-formulary list, you won't get them. And ironic as it may seem, if they're on their generic formulary list, which you should be getting, you still may not get them, but not for a good reason, just because, as it happened with one individual who went into prison and he was on a very cheap medication. It was a diuretic, hydrochlorothiazide, and it's a water pill. And the nurse, who was, I guess, the first medical individual who saw him, decided to lower the dose that he had been taking forever, that was on his medical record. And he wound up having cardiac issues. Then they changed the medication. They didn't put back him on the dose that he was taking that was in his medical record, on his pre-sentence report, and on the original prescription he brought with him. But they changed the drug from a diuretic to lisinopril, a completely different type of drug, which he wound up with multiple visits to emergency rooms, transient ischemic attacks, and ultimately with a judge who was aggravated to the extent at the Bureau of Prisons where he had to grant them an individual compassionate release to hospital. So even if you do everything right and get all of your records done, there's no guarantee that all your medications, if you have a medical issue, is going to be given to you in the appropriate manner. But at least you'll have a paper trail or medical documentation to back you up. So that what I'm trying to share with you is that you need to have all of your records, no matter how innocent they may or not important they may seem to be to you, they need to be there and available for you, a medical consultant, to work with your attorney, myself, someone like me, to make sure that they're included into your pre-sentence report, your narrative into your pre-sentence report, other letters and letters from your physicians that explain that if you're on a non-formulary medication, they need to go over all the other drugs that are on the Bureau of Prison formulary, and they need to explain drug by drug why they are ineffective for you and the complications that may happen should they be given to you. At any rate, so I hope this has helped you, and I appreciate you taking the time to listen. The inmate copayment system is definitely triggered in prisons and jails across the country. State prisons and jails are much more expensive than federal. If you have questions, please don't hesitate to reach out and contact me, Mark Blatstein, Dr. Blatstein, 240-888-7778, Physician Pre-Sentence Report Service. I thank you for taking the time to listen and have a good day.